Okay, it is 7:05, so I'm going to get us started just in the interest of everyone's time. Again, welcome everyone. My name is Arthur Charles. I'm the community educator for the Pride Center of Staten Island, and we're going to be having a town hall this evening discussing the current state of COVID-19, as well as managing the holidays and our expectations of what's to come during this festive time of year during this particular pandemic. We are partnered with the Test and Trace Corp to bring you this event, and I want to give you a sense of what we're going to be discussing today. So during this event, we're going to talk more about COVID-19's data, some COVID facts and myths, test and trace, and upcoming therapeutic options. Our counseling and support staff at the Pride Center will discuss mental health options and mental health programming that we're able to offer. We're going to discuss some strategies for safe in-person gatherings and just ideas on what to do in terms of remote gathering and different alternatives to gathering in a traditional sense. Our guest speakers today will be Dr. Ginny Mantello, the Director of Health and Wellness from the Office of the Staten Island Borough President, as well as Tommy Cicino Gio, our Manager of Counseling Service for the Pride Center of Staten Island. We ask that you do stay muted during this. You can keep your camera off or on if you'd like, however you're comfortable. We also really want to emphasize that folks should ask questions throughout the presentation. Excuse me, I'm having a tech issue.
Donna, join the meeting.
So yes, thank you for that little tech issue. So as we said, please ask questions in the chat as they come up. I will share them with Dr. Mantello in the group as it makes sense. So any questions you have pertaining to COVID testing and holiday strategies, again, get them ready and please ask them in the chat. As we are letting more people in, we're going to get started again in the interest of time. I'm going to introduce our first speaker, Dr. Ginny Mantello, is the Director of Health and Wellness at the Office of the Staten Island Borough President. She's attending neuroradiologist at Montefiore Medical Center in New York City and Mainline Health Systems in Pennsylvania. She is the co-chair of multiple large initiatives and coalitions, including the Staten Island Asthma Coalition, the Staten Island Child Wellness Initiative, the Staten Island Medical Ecosystem for Disaster Preparedness. Dr. Mantello works very closely with public health focused agencies like SIPCW, the Staten Island Partnership for Community Wellness, and the Staten Island Performing Providers System, or the SIPPS, working on Medicaid health reform and population health improvement projects. She also works closely with the two hospitals, Staten Island University Hospital or Northwell Health, and Richmond University Medical Center, and 5 federally qualified health centers, as well as the 10 skilled nursing facilities on Staten Island. Her focus is on upstream primary prevention and early intervention in the youth, with emphasis on asthma, obesity, and behavioral health. Over the past 6 years in this role, Dr. Ginny has worked closely with over 75 healthcare providers, community-based organizations, government partners, as well as city, state, and national partners. She works closely with schools in implementing wellness councils and with the community on promoting preventative screenings and healthy lifestyle programs. So with all that going on, she made some time to come and talk with us today, and we're grateful for that. So without any further ado, I'm going to allow Dr. Mantello to share her screen and give us some updates on what's going on with COVID. Dr. Mantello, you're muted. Okay.
Thank you so much, Arthur, and good evening, everyone. I just want to make sure that everybody can see my screen. Yes, great. Thank you so much. Thank you to all those that have joined this evening. But more importantly, thank you to the Pride Center and their entire team for inviting me and for putting this town hall together. We at the Borough President's Office really love the work and appreciate the work of the Pride Center, and we're always here to help and support. And I'm glad that I was able to join you all this evening. So I do have a lot of information to share, and while I don't like a monologue, I like to have a conversation with people back and forth. I know that the primary goal was try to get a lot of information out, particularly as the situation is evolving so very rapidly. And as you heard from Arthur, and really the message is we want everyone to be safe. And how do we do this safely and at the same time protect the ones that are vulnerable, our loved ones, and be able to enjoy the upcoming holiday season. So I'm going to get started, and if there are any questions, as Arthur mentioned, please share them in the chat box. So I hope, and I might go a little quickly, but I know that the presentation will be recorded and shared. So I will be covering a lot of things, including the current landscape, and I hope to present kind of a global picture and then sort of bring it down to a local level and talk about what's going on Staten Island. Just very quickly review some signs and symptoms of COVID, talk a little bit about COVID versus flu and why this year more than ever, it's important to get your flu shot. The core 4 plus testing, and I know that the Pride Center will also be covering some of this since they are one of our trusted T2 partners. But again, emphasizing the importance of wearing a mask, where you could get tested, what happens if you test positive, and what should you do next. And of course, that's where our T2 partners and our navigation teams come into place. And then focusing a little bit on best practices for holiday gatherings, some COVID myths, and I know there's a lot of them floating around, so I'm not going to be able to cover all of them, but I'll go over a few of the ones that I've heard frequently. And then to wrap it up, just some vaccination and therapeutic update and some mental health resources. So we'll start off with kind of the landscape, and I'm sure by now everybody is sort of very well versed and familiar with the first chapter, where we know that COVID-19, also referred to as SARS-CoV-2, is a viral illness that started in Wuhan, China, and that rapidly spread across the globe. And we know that we initially thought it was a purely respiratory illness, but we have learned so much in the last 10 months or 9 months about this virus. And we call it a novel coronavirus because we have never seen this coronavirus in humans. We've definitely had other strains of coronavirus that we've seen in the past, but COVID-19 is a novel coronavirus, and that's why for the first few months, we really had no idea how it was going to behave, how it was transmitted, and what are some of the things that we should have been doing to prevent it as well as to mitigate it. So now we know a lot more, and I'll share some of that. But here's some current data just to put things in perspective as of yesterday. So globally, there are over 53 million cases of COVID-19, and there have been over 1.3 million deaths. The United States actually leads the pack in both the number of cases as well as number of deaths, unfortunately. And we have currently over 11 million cases in the United States that since the time it started, the pandemic. And we've had close to 246,000 deaths. I mean, if you put it in perspective, that's in a very short period from February or March up until now. New York State has had 561,000 cases and 33,400 deaths. This number is a little different from what you'll see on the state website. And the reason for that is that the state gives you confirmed deaths, but there have been a lot of people that died at home, that also died at nursing homes that were presumed. And we didn't have the exact diagnosis because we were not testing that frequently early on. Coming to New York City, we've had about over 269,000 cases. The city was the one that started putting out the deaths in terms of confirmed and presumed. We've had about 19,500 confirmed deaths and about 4,600 presumed deaths. And on Staten Island, we've had close to 20,000 cases since the pandemic started, and the number of deaths that are confirmed are 921 and presumed are 186. And again, to put it in perspective, on a year where we say that we've had a really bad opioid epidemic, we've seen about 110 deaths on Staten Island. So we've had 1,100 deaths since March just related to COVID-19. And I still remember March 1st was the first case in New York. And I have many journals and books I've kept since then. By March 15th, we had about 2,500 cases. And by March 25th or so, there were 25,000. So it was doubling really, really rapidly early on. We are starting to see some numbers close to March, but fortunately, the difference is now we know a lot more. Plus, we have our test and trace teams to help. And so we're hoping that we can keep this at bay and keep the curve flattened, unlike the first time around. So moving on, we have really seen, if you talk to some people, they'll say this is the second wave, but really this is the third wave. And this is just a graphic to show you. If you look at the very first wave, that was predominantly New York and the East Coast, and also some parts of the West Coast, California and such. Then we started to improve. The second wave we saw was mostly the South and parts of the West, and it was Florida, Texas, Arizona, and they saw a tremendous surge. And now this is the third wave, where it is a lot of cases in the Midwest, but also extending to involve almost the entire country. And this is just a map to show you, and I wish I had a comparison to show you what it looked like in April versus now. But if you can imagine, at that time, the darker blues at the highest numbers were more along the East Coast and the West Coast. It then went down to the South, where you can see Florida, Texas, and also Arizona were involved. Now, this is the current scenario, but it seems to be rapidly spreading across the entire country. And just to sort of tell you that we are seeing the likes of 1 million cases increasing in a week per week in this country, almost 180,000 cases per day, which is significantly higher than what we saw in the first wave. This is a snapshot of the New York State Department of Health COVID-19 tracker, and you can see on the left-hand side, it talks about the number of people that we have tested thus far in New York State, and that's a pretty large number, over 16 million, and we have really ramped up testing like no other state. So that's really remarkable. The total people that have tested positive just on this day, which was 11/14, was the total people that were tested, not tested positive, but that were tested on this day was 133,202. And then total tested positive thus far is 560.
Dr. Mantello, I wanted to ask you about the testing. Was that 17 million individual people or individual tests?
This is a total people tested. I don't know if there's duplication there, but they report it as the total number of tests that have been performed. And then you can see at the bottom the new tests positive for that day. And I just want to mention really quick that I have included sort of an interactive live link in here so that people, and I know that this is something that has also been shared by you, Arthur, and Asia, and the rest of the team that have so graciously worked with me. But you could, just to show you what it looks like if you go into the website, and you can actually change the, and you can look for trends. You can look at the fatality, how many died. You can go by county on the right-hand side. For instance, if I wanted to show Staten Island at this current moment, the same information on Staten Island, I click Richmond. And at the bottom, if you are able to see the total people tested on Staten Island, those that have tested positive thus far, and the percentage positivity rate, the people tested today, and the number of new positives for today. So that's kind of, and I would urge people to spend some time going through some of these links that I've included. So moving on, this is the most recent data of, from the City Department of Health website. They have recently updated their website. And again, I've included an interactive link just to show you what it looks like when you go onto their page. It shows you the latest data, the trends, totals, as well as the milestones. All I did was include a snapshot of the summary, which compares the most recent data and shows you that it's increasing or decreasing as far as the trend. This is new as of today. This is decreasing as of yesterday. It was still increasing. What's also great is you could go by zip code, and I'll show you this later, but you can go by borough and by zip code. And if you bring up, for instance, by borough, it can bring up some other additional maps. If you go by table, it'll bring up each zip code. You can go to your respective zip code. And if I go to 103, which is most of our zip codes, you'll see some of our zip codes, how they're faring. And many of these are way higher than they should be. And we'll talk about that in a minute. Here's what I referenced before. This is the data from City Health Department that shows the percentage of people that tested positive by zip code for the most recent 7 days of available data. And you can see on the map, the darkest areas are those that are faring the worst. And we have many zip codes on Staten Island that are fairly dark red, indicating the high positivity rates. Here's a snapshot of what I showed you before in terms of the 7-day percent. The dark lines are Staten Island and the city averages. So the bottom blue line is the city average. The green line on the top is Staten Island. You can see we're well above the city average. And these lighter gray squiggly lines are the different zip codes on Staten Island, and you can see some of them are spiking well over 6%. And we want to keep them ideally, obviously below 2% and certainly below 3%. So we're having some really, unwarranted clusters and spikes, which we want to try to curb at the moment. So I'm going to focus for the next couple of minutes on something that the governor and the state health department have started, and I'm sure many are familiar with this. It's the Neocluster Zone initiative, and for the past few weeks, the governor and his staff have been working on setting up multiple zones statewide based on the positivity rate in those zones. Those are broken down into red, orange, and yellow zones, and the red is the most stringent in terms of restrictions. In the red zone, it's really only essential services that are open. The schools are closed, businesses are closed, restaurants are closed. And similarly, the orange zone has some lesser restrictions than the red. And then we're going to talk a little bit about the yellow zones, but for a while there, it was Brooklyn, Queens, Rockland, and a few other counties in New York State that were in the red, orange, and yellow. But recently, they've been watching the Staten Island data. And since we have a high 7-day positivity rate as of November 11th, I believe, the majority of Staten Island was put in a yellow zone restriction. Now, if you go on to the link here, that will take you into more details about the various zones and the implications. But for Staten Island, it's more important to understand the yellow zone restrictions. So as I mentioned, that our 7-day average had gone over 3%, and new hospitalizations as well as other metrics were, new hospitalizations were rising, so were the number of deaths and ICU cases. So the governor's office and the state takes a lot of things into account when they put zones, these yellow zones, red zone restrictions. So because of that, we were put in the yellow zone. And what that means is that it's prompted extensive outreach and testing efforts on Staten Island. And I know that our T2 partners have certainly been involved in those efforts and in helping micro sites as well as a hyperlocal response, which is with the City Health Department and H&H, which are the T2 partners. So what are some of the yellow zone restrictions? Just quickly to say, yellow is really like a warning. It's a precautionary zone. So like I said, it's less stringent. Some of the restrictions include the houses of worship, 20%, at 50% capacity. The mass gatherings, they're asking to cap at 25 people indoor and outdoor. What I didn't include, one more thing, is that they're also asking to limit personal gatherings, indoor or outdoors, to no more than 10 people. And I know that's going to be difficult during the holidays, and we'll talk about some of that as well. The businesses still remain open. Indoor and outdoor dining is open, but it's capped at 4-person maximum per table. Schools remain open, but are required to do mandatory testing weekly of 20% of students, teachers, and staff if they want to continue the in-person setting. And then it also has implication for our nursing homes where they need to continue to test their staff twice a week now instead of once weekly. Those are the yellow zone restrictions. And if there's no questions on that, I can move on to just very quickly talk about some of the signs and symptoms of COVID, and then go on to COVID and flu, some of the key similarities and differences, as well as a few other things.
Excuse me, Dr. Jenny. One question did come up as you're going through the signs and symptoms, especially for COVID versus flu. It was a question: if a person has asthma and allergies, how would they also be able to tell the difference between COVID and that type of symptom?
Right. We will, again, we won't go too much in depth of all the signs and symptoms, particularly, and I am working in my office to create a simple graphic on flu versus COVID. We can expand that to include allergies as well as the cold. What I will say is that, unfortunately, there's a lot of overlap in the symptoms. So you have to be mindful that many of these can present as cough, shortness of breath, fatigue, muscle ache, body ache, headache, sore throat, and fever and chills. So all of these are overlapping in, not in allergies, but certainly for the flu and COVID, there's a lot of overlap. What's important also to remember is that COVID is of particular importance because it can be more severe in those with underlying health issues, particularly chronic diseases like asthma, hypertension, diabetes, congestive heart failure, heart disease. And so if you do have underlying symptoms, if you do have an underlying chronic illness, you should be more aware and more mindful. And if you end up with fever or chills or shortness of breath, and you're not sure if this is like your typical asthma attack, you should address it, seek help from your healthcare provider. And there's a good likelihood that you might have to be tested for COVID as well as the flu. So you might have to get more than one test. Again, these symptoms are not, totally exclusive of COVID. What we do see in COVID is an early new sense of taste and smell, which doesn't typically occur in the others. The other thing that I want to mention, and I think I do talk about it in COVID. Key differences. So as I mentioned, there are many similarities. So doctors will often be testing for both. Some of the key differences is obviously COVID. We talked about this. It's caused by novel coronavirus, and flu is caused by the influenza virus. COVID seems to spread more easily than the flu and causes more serious illness in people. And I think that what's important to understand, and this is why we've really had a hard time in getting a total handle on the disease, is because you could be infectious even before you show symptoms. So typically people become symptomatic at day 5, but they can be contagious for 2 days prior and up to 14 days after exposure. So COVID also spreads much easier, and it's the way it spreads is by both by droplet and aerosol, spread. And so it's important to keep that in mind. So COVID can take longer before people show symptoms. With flu, typically you get the symptoms, and by day 3, 4, you're recovering. You're also not, you're infectious about a day prior and for 3 or 4 days after, and then you're not infectious. Whereas with COVID, it's a much longer window than the flu. I already referenced the taste and smell, loss of taste and smell. Of course, there's the vaccine to protect against flu, and that's why it's important to take it, particularly this year when you have 2 viruses present simultaneously. You want to try to be able to protect yourself against at least the one where we know we have a vaccine. Currently, there's no vaccine yet to prevent COVID, although we're waiting emergency use authorization on a number of them, and I'll cover that briefly as we move on. And then flu can be treated early on with antiviral drugs such as Tamiflu. And there are treatments for COVID that we've learned over the last few months. Some of them include starting patients early on steroids, as well as other treatments like remdesivir. And now there's a new approved monoclonal antibody treatment that has also just become available as of 5 days ago. The link below here really goes into much more detail at the CDC website on the key similarities and differences between flu and COVID. And you can also go on that CDC website and learn more about overlap in symptoms in terms of the common cold and allergies and COVID. Okay, here's a snapshot of something that was posted at our office.
Pardon me, Dr. Mantello, there was a question about testing. I want to make sure we address it while we're still on the topic. Somebody asked, if you do not start to show symptoms until the 5th day, would getting tested between days 0 and 5 be effective at turning up a positive result, even if you're asymptomatic?
So the likelihood of the positive result goes up if you wait. So there is a possibility you could still test positive a day or 2 after, but if you waited for 4 to 5 days, there's that much more likely, it's much more likely for you to test positive. The sensitivity goes up more. But remember, you can still be infectious. So it's still worth getting your test, even if you waited a little bit, if you got it at day 5 or day 6, it's still important to get that test. If you've had, and some of the, when we talk about testing, and I'm going to cover this a little bit as well about who should get tested immediately and what are the scenarios. So we'll talk about that when we go to testing in a minute. So this is just, reminding everybody, all the CVS locations, Walgreens locations, Rite Aids, they're offering no out-of-pocket cost free flu shots where they just take your health insurance and you can get free flu shots. I also want to add that there are multiple community events that we've worked on with our partners. There's 3 or 4 upcoming events, and I'm happy to share those flyers after this with both Asia and Arthur and the Pride Center to push out. We have them at the NYCHA community centers, at the senior centers. We've also hosted events with the YMCA, the JCC, Wagner College, and multiple other partners, and those have been, and Central Family Life Center. If any of your organizations would like to host a flu clinic, even for your staff or your constituents, your members, feel free to reach out to me, and I can certainly connect you to our partners within CVS and Staten Island University Hospital and others to be able to come and do those flu shots for you, your staff, and your constituents. So very quickly, and I don't want to preach to the choir. I know that this is really the test and trace sort of core 4 message, but we have been pushing it out from day one. And to remind everybody, the core 4 includes washing your hands frequently, wearing a mask, staying home when sick, and certainly getting tested. What is the core 4 plus testing? That is also all of the same. Keep your hands clean, physical distancing, stay home if sick, wear a mask, and now we've added to that message to say there's free COVID testing. And if you are in areas where there's high community penetrance, like we are in now, please get tested frequently. There's guidance on who should get tested when, and I'm going to cover that in a second. In terms of masks, if there's one thing you leave tonight with one message, it's please protect yourself and the people you love and those around you by wearing a mask. CDC had initially said when you wear a mask, you really protect those around you, but really they came back and they changed the guidance last week and updated it to say when you wear a mask, not only do you protect those around you, but you also protect yourself, and it prevents you getting sick as well, because it blocks out certain amount of virus particles. So what is the requirement? The New York State law requires anyone over the age of 2 who can medically tolerate it to wear a face mask when in public. And if you're unable to maintain 6 feet of distance, what I say is that it's not mutually exclusive. You need to do all of these things in conjunction to be really protected the most. So if you want 99 to 100% protection, you should be doing all of them, meaning socially distancing, wearing a mask, washing your hands frequently, staying home when sick. And if you took any one of those variables away, your risk goes up. And similarly, if you're outdoors or if you're in a setting indoors where your risk goes up more, if one person wears a mask and the other, the chance goes up of transmitting it. And if both don't wear it, of course, the chance goes up even more. If you're indoors versus outdoors, the risk of spreading it is more indoors versus outdoors. You also need to wear face coverings when riding public transportation and as much as possible in any indoor spaces like places of worship, offices, and even if you can maintain that 6 feet distance. So who should get tested? And I know we covered some of this already, but you should get tested immediately or as soon as possible if you have symptoms, if you've had close contact with somebody who had COVID, if you live or work in an area with increased COVID-19 transmission. And then this allows you to go to the zone and you can see it'll bring you to the same map with the Staten Island yellow zone. You also need to get tested if you return to New York from a non-contiguous state with a high level of COVID. And the travel guidance has changed recently, and now you don't have to quarantine for 14 days. You have an option. You can get a test 3 days prior to coming back to New York and then get repeat tested on day 4 after coming back. If both are negative, you don't need to quarantine for 14 days. And then you should also get tested if you've attended a large gathering or a party. But for that, I always say wait a couple of days to increase your likelihood of the test coming back positive. Some scenarios you need to get tested once a month or as recommended by your healthcare provider or employer. Some of these examples are healthcare workers, first responders, essential workers with frequent direct contact, or those living in group and residential settings. Now, if your test result is negative and you are having symptoms, you need to consult with your healthcare provider about whether you should get tested again. Also, just want to remind everybody that the tests are not 100% accurate, and depending on what kind of test, if you get a rapid point of care, it's not as sensitive. So the PCR testing is the gold standard, and that's what you should try to get, but the results don't come back sometimes for a day or two. And these are just some examples of where you can get tested on Staten Island. This is actually rapidly evolving. What I would urge you to do is you could find testing sites either from the state or the city website or by texting COVID test. You can go on our Staten Island USA website, and I would urge you all also to go on our social media page where we put the most updated information on testing. Here are some additional sites, for example, that are going to be offered and have been offered already this week. And going on to next week, there'll be some additional sites that are being offered. This is just when you go on our social page and our Staten Island USA main homepage, you can access all the testing sites that are available on Staten Island. And then on the right-hand side of the screen, you can see some of what we posted this past week on new testing sites, as well as what you can do to fight COVID. So the more current things get updated on our social media pages. So trying to wrap it up now.
Pardon me,
Yes.
Dr. Mantel, there was a couple of test questions that came in now that before we move on to the next section. One person had asked about Staten Island specifically. Let's say you live in one of those yellow zones. How frequently should a person who lives in the yellow zone get tested? I think is how I'm reading that question.
Right. So I would say that at least once a month. And if you are symptomatic, more frequently, or if your employer requires it, certain settings are requiring to do it more frequently. For example, if you are, in a vulnerable, dealing with a vulnerable part of the community, or if you are with schools and certain other healthcare fields are requiring different. So I think that it would be reasonable to say get tested once a week, unless you have any of those other scenarios where you came in contact with somebody, you traveled, or you're symptomatic, and so on and so forth. Okay. So it would defer to the immediate setting if it was any one of those others.
And then another question we had, and I think you spoke to this a little bit, I want to make sure that we have a clear answer, the accuracy of different tests. So you're saying there's a gold standard, if you could just repeat what that was.
Yeah. The gold standard is the PCR test, and what they do is commonly for the PCR, they either do a nasopharyngeal swab. So for those that have had it, it's the longer Q-tip, but now they can also do the PCR test using a shorter nasal swab. Some places even offer it out with a saliva test, but we haven't really been doing that. And then the other kind of test is the rapid point of care, where the results come in 15 minutes, and that's more of an antigen test, which is less accurate. So usually the PCR tests take longer to come back. In the community setting, they take anywhere between 24 hours to 3 to 4 days. Now it's coming back in a quicker time period. There was a while it was taking almost a week to come back, but now you can get the results in 1 to 2 days.
Great, wonderful. The other question we have is about holidays. So I'm going to let you speak first and see if we don't cover it in your talk.
Sure. So I know that this is painful to hear, and that we are all, we have COVID fatigue. We would very much like to let our guard down and go see our family that we haven't seen in so long, hug our friends and hug our family members. But remember, it's really not even just about you. It's about protecting your family members, protecting the elderly people in your family, and keeping everybody safe. So when you make plans to celebrate the holiday season, keep all of that in mind, and keep your loved ones in mind, because you don't want to ever feel like you are responsible for spreading something to your family members. So try, if possible, to not travel and stay home and rediscover the holidays at home. And what does that mean? You might have to host a virtual holiday party. Don't gather in groups, because the test and trace data has shown us that most of the community transmission right now is not happening from large events. It's really happening from smaller events that people are hosting within their homes, or parties, or, for example, most recently during Halloween celebrations. And we really want to try to emphasize that please, as much as possible, while obviously nobody can come to your home and tell you, don't have your family, just be mindful. And let's say, for argument's sake, you did feel compelled that you had to see family members, then the best way to do it is quarantine yourself for 2 weeks prior, get tested within 3 days of seeing your family member, ideally even 24 to 48 hours prior, and then try to limit the gatherings to under 10 people. And really, that's also the new yellow zone restriction, is 10. And I understand that you can't do outdoor celebrations right now. It's too cold, but try to do other outdoor activities to keep yourself busy. Go, walk around the neighborhood, look at the lights and decorations, go drop off some holiday cheer cookies to your neighbor, and then try to connect with some old friends virtually, or have frequent Zoom calls with your family. So those are my recommendations. You can find more detailed when you go to the City Health Department website. Also, CDC has put out safe holiday gathering guidelines. And I know that Asia will also be touching upon some of this a little bit later. So I don't know if that answers the questions, but happy to address anything that I didn't cover so far. Arthur, did that answer the question?
So no, I mean, again, I want to reword it. So they had a very specific example. Essentially, they're saying that the family is going to be having 2 relatives visiting from the Boston area who are currently quarantining. They're going to get tested before they come to New York, and when they come back, they're going to quarantine again, as well as doing testing. It sounds like, based on what you've just said, plus the other recommendations of leaving states, they are actually falling within best practices. So I think we did answer their question.
Yes.
And then since then, we've gotten another question asking us the longevity of antibodies in people. Like, how long are we seeing folks have their antibodies for?
So that's a $1 million question. And the answer is we don't exactly know. We have seen very few, people getting reinfected with COVID. And I don't, I should knock on wood when I say that. We're seeing the antibodies lasting for at least a few months out, 3 to 5 months, but we don't have the full answer or knowledge yet about how long the antibodies last. Now, this is why we are really relying on an effective vaccine. And in order to get herd immunity, we are going to have a number of things working in our favor. So we have 20% or 20 plus percent of our community that's already been exposed to it and has antibodies. And for those that have not, we hope that we can, vaccinate a large proportion. So we need about 70 to 80% of our population to have that immunity in order to have herd immunity. So what are some of the myths? And I know that we wanted to leave time for questions, but since we've been doing questions, while talking, I'm assuming I can continue for another 5 minutes. So a lot of times I hear, starting from people saying COVID-19 in itself is not real, it's a myth. And I say to people, it's really sad to hear that, but if you had spent 1 hour in our hospitals at the peak of this pandemic during the end of March or early April, you would never, ever, ever question whether it was real or not. So we went through, New York in particular went through a very difficult time in March and April. And I would never wish for us to go through that again. And while we do have more therapeutics, more knowledge about the disease and how to treat it, I will tell you that it's as simple as this. A pandemic ends, or I should say an outbreak ends, when the people want it to end. And that happens when they change their attitudes, when they change what they're doing, and they all are able to work together and end it, right? And that means is that all of us need to realize we should follow the science. We should really be looking at the guidance. This is not the first time we've had an outbreak. Masks have worked forever. We've known that masks protect us well before we had COVID. So why are we trying to reinvent the wheel? There's many studies that show masks work. Another example is of a myth is if I go to a hospital for another reason, I'll get COVID. That's not true. Our hospitals have taken every precaution to make sure that they're safe. In fact, we have Northwell, Staten Island University Hospital South being the COVID-free hospital. I know even in Rumsey, there are areas designated and every precautions being taken to protect anybody that comes into the hospital to make sure they're safe. Another myth that I commonly hear is that myth is that I won't catch the virus if I don't spend too much time next to someone who has it. And the CDC recently updated their guidance to say that if you have cumulative contact for somebody over 24 hours, you could still contract it, meaning that it doesn't have to be 10 or 15 minutes at a stretch, which is what they initially said. It could be, 2 minutes, 5 minutes, over repeatedly over 24 hours, and that's still a risk. Many young people say to me that oh, doesn't seem to be that younger people get it or are as affected, and it's only people that are older with other medical conditions that it impacts. That is so not true. Firstly, I will tell you that the current shift is that more younger people are testing positive. Between 25 and 44 is what we see the highest number testing positive. Many of them, I agree, are mild or asymptomatic cases, but the problem is that they are then able to transmit it to the elderly. I also want to mention that there are right now 12 to 1,300 people dying daily of COVID-19, and 25% of those are between 25 and 64 years of age, which means daily we're losing 300 people prematurely. So that's one person is way too many for me. So losing 350 people is way too many below that age of 65. Some myths around mask wearing. I think I talked about this. There's plenty of research to show that masks work and face coverings, and also myths around social distancing. I covered this already. It's not mutually exclusive as far as I'm concerned. You have to do all of it in conjunction to be the safest. So you have to wear a mask, social distance, as well as make sure that people around you are wearing masks and doing the same. And one other quick one is often I hear people say if you wear a mask for long periods of time, it'll make me sick. There's accumulation of carbon dioxide, so on and so forth. And that is not true, that wearing a mask will not make you sick. All of us healthcare workers would have been sick then, because we're wearing masks for prolonged periods of time, sometimes even the tight N95 masks. So that's not true. So you're going to ask me, after all that gloom and doom, is there any silver lining? Or are there any silver linings to these dark clouds? And actually, there are many. And I think we're going to look back and we're going to say, well, we really evolved and really changed how we were practicing medicine faster than we could have ever imagined. And an example of that is, and for the better, an example of that is we have done in the last few months what would have taken us a decade or more. And a perfect example is telemedicine. I know that very, very quickly early on, most of the practices stood up telemedicine and remote services, and now almost 100% of practices, primary care physicians and specialty care are able to offer consultation remotely. And so that's just one example. There's always limitations to technology, but certainly we have been doing a tremendous job getting a lot of things approved from the governor and the state that we would have normally taken a long time to get approved. Also, the other silver lining is that we have seen a lot of treatments now for COVID-19. And as I mentioned to you, that couple of silver linings and things in the works are the new COVID-19 vaccine and the monoclonal antibody treatment. There are 4 vaccines currently in phase 3 trial in the United States. Many across the world are developing vaccines, and there's almost a race for the vaccine. We're the closest, and actually today, hot off the press, Moderna declared that their vaccine has a 94% sensitivity. Pfizer had come out recently and said theirs is 90% sensitive. There are pros and cons to all of these. They all have to be given in 2 doses, except the Johnson & Johnson vaccine, which is a single dose. The Pfizer has to be stored at -70 to -90, which is an extreme temperature. So there's limitations with that. Some of them can be stored at normal in a freezer or for certain periods of time. So those are things that we're looking at closely. We're also going to be examining the data very closely. I know there are many city and state health department have set up many expert panels to review the data that the CDC, FDA are going to be sharing, and also these companies. So what about the monoclonal antibodies? So on November 9th, the FDA gave emergency use authorization for use of this antibody therapy. Now, remember, this is not a full approval by the FDA. It is just emergency use, which means they're still reviewing the data. It's important for those in the community because this particular therapy, if you remember, Governor Christie and President Trump also received the monoclonal antibodies. It's for those that are, at least the first one, the Eli Lilly, is for those that are not hospitalized, not on ventilators, but high-risk people in the community. And then the second one, as I mentioned, which is Regeneron, is also being reviewed actively by the FDA for emergency use authorization. And so we hope that that'll be approved soon as well. To wrap up the mental health resources, and I know that Tommy will be covering some of these in great length, I would just venture to say that we have seen a great amount of stress, anxiety, uncertainty, whether it be the youth, whether it be the parents having to deal with the at-home learning, whether it be teachers, whether it be staff, whether it be schools. Everybody has been feeling extremely anxious and stressed, understandably, during these times. There's many options out there to get support. I've included some resources from our partners at the Staten Island Partnership for Community Wellness and our Tackling Youth Substance Abuse. We have many resources on our page, Staten Island USA, and there's also resources that the city and state have. But the simplest resource and the most easily accessible is the 1-888 NYC Well. Not only their website, but also the number. You can call and get help 24/7. A counselor will talk you through it. They will also help you navigate their website, and you can search for what suits you best and your needs. And they can also link you to our local providers on the ground. So please, if anybody has any issues and is experiencing any kind of anxiety, depression, stress, or any other mental health issue, please call the NYC Well line or go to their website and check it out. There's also resources by neighborhood that are available, and these are available at the City Health Department website, and I've just included some of those links. And you can go and check out these resources. And once again, I want to leave you with this with this message. If there's one thing that you take back from today, it's wear a mask, encourage everybody around you to wear a mask, your family, your friends, and your loved ones. And let's all try to get on top of this, stay safe. And
Dr. Montello, in that vein of your final wonderful point, somebody did ask about mask quality between those single layer and triple layers and paper and cloth. So just any guidelines you want to share, how important that is.
Sure. Absolutely. And I will share a link later on with you, Arthur and Asia, to send out. So I will put it this way. Any face covering is better than no face covering. Remember, large droplets are transmitted when you speak, when you cough, when you sing, when you shout. And so we want to try, and remember, again, there's two different aspects. One is talking about, protecting the people around you, and any face covering will stop the droplet spread. In terms of what would be, so early on, if you remember that, and this was some of controversy about wearing a mask, not wearing a mask. If we do wear face coverings, we want to try to have at least a 2-ply, preferably, and then the surgical masks 3-ply. But we want to also be mindful that we don't deplete the resources for the healthcare workers and the frontline first responders that are constantly running out into the fire, so to speak. And we need to keep them protected so we don't deplete the resources for them. So certainly, wear a face covering. If you can, get 2 layers in your cloth mask, certainly that is helpful. If you're going to wear a surgical mask, a 2 or 3-ply, the 3-ply ones are the ones we use for the healthcare providers. But it's better than wearing something is better than not wearing. And I'm going to share a much more detailed, about different types of masks, if you like.
Thank you for that. So I want to thank you again, Dr. Montello, for all this fantastic information. In the interest of being transparent, we did run over on time, but we'd asked that for folks who are able to stay with us, we wanted to cover some things about support services and strategies with the intent of wrapping up by 8:30. So just give us a few more moments. If there's any other questions for Dr. Montello before we move on, please feel free to send those in. Otherwise, again, thank you so much for all this fabulous information, Dr. Montello, truly.
My pleasure, my pleasure. And if there's any questions, people can still send them later on.
Yeah, absolutely. And I'll get them to you if for some reason we don't get to cover them. I'll make sure they're answered.
You can share my my email as well in the chat if you like.
Yes, I would love that. And can I ask you to stop sharing your screen, please? Thank you. Okay, so in the interest of time, I'm going to go move right on into my colleague, Tommy Cicino de Chico. Tommy is the Counseling Services Manager at the Pride Center of Staten Island. In addition to managing his own caseload of therapeutic clients, he also oversees various support groups that we're going to discuss briefly this evening at the Pride Center, and our team of mental health counselors and social work interns. Tommy comes to us from having had previous experiences in crisis and suicide intervention. He worked previously with Vibrant Emotional Health and the Trevor Project. So I'm going to turn this over to Tommy. Thank you so much for joining us.
Of course. Thank you so much for having me this evening. And I'm very excited to tell you a little bit more about these services that the Counseling Services Program at the Pride Center of Staten Island offers currently. So at this current moment, not only do we provide individual, couples, family, and group counseling, but I'm going to get into a little bit more about the specific demographics that each of the group counseling covers. But yes, currently we do see clients individually, as couples, and then as family members who may be interested in working and navigating with their LGBTQ loved ones, any struggles or concerns or obstacles that they may be having in their, day-to-day journeys. In addition to, or to further elaborate on some of the group counseling that we provide, some of these groups can be provided on an as-needed basis, such as our bereavement group that I'll tell you a little bit more about further on. But what I really adore and love about the Pride Center is that we are so quickly able to meet the needs of our population as they present themselves. So I'm going to share a little bit more about how that's happened in the past, and how we could also offer that in the future moving ahead. So the first group that I wanted to speak of is actually a group that will be starting up very shortly. It is called GSPEC, which is short for Gender Spectrum. It occurs weekly it'll occur weekly on Tuesdays between the hours of 6 and 7 p.m. And that will be beginning on December 15th. It is open to youth between the ages of 12 to 17. And the goal of the space is to essentially provide a brave space for youth across the gender spectrum, meaning of any gender identity, to facilitate a discussion on topics relating back to TGNC related or TGNC specific topics, and the intersectionality of the youth experience, because that is a very unique experience in and of itself. Some of these topics can range from coming out to family, coming out to friends, navigating being out in school, identity development, and so much more. And moving along, then we have Transcendence, which is its sort of adult counterpart. Transcendence is offered weekly on Fridays between the hours of 6 and 8 p.m. It is open to individuals 18 and over who identify as TGNC or transgender, gender nonconforming. It provides a brave space for the TGNC community to have coordinated discussions on, again, TGNC related topics. So this can range from TGNC representation in the media, social transitioning in the workplace, and so much more. It's a very collaborative type of group. So we kind of work along with the participants in terms of what they like to see in programming. And then moving on, kind of as I discussed earlier, what I love about the Pride Center is that they are always capable of being able to provide services as needed. The bereavement group is a perfect example of such a group. So currently, the bereavement group is meeting weekly on Fridays between 6 and 7:30 p.m. It's open to any LGBTQ individual 18 and over who has experienced loss, or to anyone who may have lost someone LGBTQ identifying. Now, navigating through the process of COVID is especially difficult at this particular moment in time. And this is an example of a group that the Pride Center wanted to get ahead on in case the community presented as a need to kind of help them navigate through the grief process, which many of our participants have. So this space is to provide a brave space to be able to express their grief openly and in an honest way. And a lot of the time it is through a facilitated discussion on a specific topic, but group members are always able to share their unique perspectives at any point. Hey, the Decolonization Collective is actually a group that is starting up this coming Tuesday. So we're very excited to see how this rolls out. It'll be meeting weekly on Tuesdays from 7 p.m. through 8 p.m. The group exists to bring together LGBTQIA plus people of color to create, hold space, and to find solace within themselves and each other. This group focuses on the specific pillars of education, activism, and livelihood, mental health, allyship, and a brave space. Another group that is upcoming and starting on Saturday, December 5th, is the Female Empowerment Group. So the purpose of this group is to promote a brave space and sense of intersectional female empowerment for female identifying individuals between the ages of 25 through 59 within the LGBTQ plus community. They'll be meeting Saturday evenings from 6 p.m. through 8 p.m. And we're excited to see what offering the space to the demographic will be able to bring to the Pride Center. Families in Transition is definitely one of the more consistently developing groups that I've seen at the Pride Center throughout my stay. It meets bi-weekly on Thursdays from 7 p.m. through 8:30 p.m. It is open to family members and friends of TGNC identifying individuals. It is co-facilitated by my amazing colleague, Mary Anderson, who speaks from the parent perspective of a TGNC individual. In addition to my wonderful colleague, Haley, who also co-facilitates along with me on, again, that bi-weekly basis. And again, the specific purpose of this group is to provide a brave space to friends and family members of TGNC folks to help them navigate through their own emotional experience as they're also navigating through their loved ones' transitioning process. Again, another group that sort of spun out of a result of a presenting need is the Trans Male group. This group meets bi-weekly on Saturday afternoons between the hours of 3 p.m. and 5 p.m. It is open to transgender male identifying individuals 18 and over. And again, the purpose of this group is to provide a brave space to transgender male identifying individuals to discuss topics relevant to the trans male community. So again, examples of that can be accessing hormone replacement therapy, navigating top surgery, healthy relationships, and so much more. And then again, another up and coming group that's going to be provided by the Pride Center is a group known as Spiritual Pride. This group was created in collaboration with Judson Memorial Church Ministerial Program. And again, if the purpose of this is going beyond our walls and reaching out to the Staten Island with the collaborative community, again, of the Pride Center of Staten Island, to establish an area of support to the LGBTQ community and allies in a spiritual type of platform. This programming will be available every second and fourth Sunday of the month. The start date will be December 13th, 2020. And again, I should emphasize that all of the programs right now, individual counseling, group counseling, couples counseling, are all available via either telephonic counseling or via Zoom. And so again, one of the main specific topic points of today was to kind of is focusing on how to manage through the holidays right now, especially more so as far as your mental health is concerned. So some of the things to kind of just make sure to focus on and highlight is acknowledging your feelings. Listen, you know, it's definitely going to be a challenging time for everybody to try to navigate through this ever-changing type of experience right now. And one of the most important things you can do for yourself is to just kind of just take a moment and actually acknowledge, you know, how it is that you might be, you know, feeling in that moment, whether that's anxious or sad or frustrated or angry. You know, it could be really anything at this point in time. And it's okay to kind of take a moment to check in with yourself to see if, you know, what it is that you're going through. Reach out, you know, if you're feeling lonely or isolated, take that opportunity to reach out to someone that, you know, cares about you. Or I also, at the end of this slide, will be providing some resources that are available, again, to be able to provide that sense of support. And especially, you know, in terms of the Pride Center of Staten Island, you know, one of the things that we heavily emphasize is our sense of community. So if that is something that you have during this holiday season, please, in whatever means it may be, please feel free to reach out to those people. Take a breather, right? You know, I think that's probably one of the most simplest things that we can do, whether it's on the day of the holiday itself and we're trying to just get through it, you know, or, you know, if it's just on a random day leading up to it. And, you know, you're just kind of feeling the emotions as they're coming up for you. Just give yourself that 15 minutes. Just give yourself as much time as you need to be able to just collect yourself and be able to just, you know, press on moving ahead. Again, you know, seek professional help if you need it, whether it's through us at the Pride Center of Staten Island or, you know, wherever it is that you feel like you could get that sort of sense of support on a consistent and reliant basis. You know, go out there, you know, and pursue it. I've also included another helpful link that, you know, just includes other ways of being able to manage stress throughout this time. And again, if you feel so inclined to, please utilize it. And yes, again, I just wanted to reinforce the reliability of this incredible resource known as NYC Well. It is a 24/7 crisis suicide hotline for New York City residents of any age. And again, it is accessible via phone call, via text, or via chat. So there are plenty of ways to be able to access that support if you need it. For our LGBTQ folks, we do have the Trevor Lifeline, which is another incredible resource, which is specific for LGBTQ youth. But again, that is another resource that is available via call, text, or chat. Finally, we also have, I also included a link to NAMI, specifically the New York City Metro NAMI. NAMI is short for the National Alliance on Mental Illness. What's very helpful about this link is that you can actually click that to access services or groups, individual services or group services within the New York City area. And I've also found that that can be a helpful link for folks who are looking for support at any time. And yes, again, we are definitely here for you in terms of being able to provide any types of services that you might have heard or seen in our slides above. But also, if you have any other general questions or concerns that may be related to anything mental health, you can feel free to contact me, as my information is listed on the slide above. Or you could also submit your information via our online form submission that is located on our website. So all you would have to do there is just input some few pieces of information, and then a member of our team will get back to you within 24 to 48 hours.
Tommy, we did receive a question just asking if our services, specifically our services, are LGBTQ specific, or can allies or ally identified folks seek out our services?
They are typically LGBTQ oriented, but allies have certainly reached out in the past relating back to something LGBTQ specific, either in regards to a loved one or family member. So that is always, so our services are always accessible to those folks as well. Hopefully I think that answers that question.
No, yeah, and when we speak, of course, of allyship, I will just elaborate that we're talking about any person who is not identified with the LGBTQIA community, but has aligned themselves to supporting us. That is our definition of ally in a nutshell.
Yes.
All right, thank you so much, Tommy. If there are any questions for Tommy, we have a moment for that. Are there any questions? If anyone wants to unmute themselves or go into the chat, feel free. Otherwise, again, we just need a couple more minutes of folks' time to go over some holiday best practices, and again, with the intent of wrapping up by 8:30. Costs. I was asked about costs. Our services at the LGBT Center are 100% free.
Yeah.
Sorry to answer that one for you, Tommy. I just felt good that I knew the answer.
Yes, of course.
Okay, wonderful. So with that in mind, I'm gonna head on over to just some best practices when we talk about holiday gatherings during COVID-19. As Dr. Mantello mentioned earlier, we are going to be erring on the side of some of the suggestions given out by the CDC, because we find that they have some of the best, well written out, clear guidelines on how to think about the holidays as they come to us. Everyone has the ability to make Thanksgiving time and holiday visits safer. Some things that have been reiterated: wearing a mask, of course. 2 or more layers is recommended, but any face covering is better than no face covering. Wearing a mask over your nose and mouth and securing it under your chin. A lot of times we see folks wearing masks doing this thing where your nose is out and exposed. That is not a best practice. Making sure that your mask fits snugly and against the sides of your face, right? We want to make sure nothing can get in. Staying at least 6 feet away from those who do not live with you. Think about, again, we've heard the term our pod going around. Who's in your pod and who are you really interacting with regularly? Remember that some people without symptoms may be able to spread COVID or flu. So we do want to keep 6 feet, about 2 arm lengths or 1 my whole body from others, especially during important times for people who are at higher risk of getting very ill. Wash your hands often with soap and water for at least 20 seconds. Keep hand sanitizer with you and use it when you're unable to wash your hands. And use hand sanitizer that's made up with at least 60% alcohol. I know that when I'm out in the stores now, I'm seeing that it's very clear how much the alcohol content is on bottles. They're making it more and more visible, so look out for that. Food and drink safety. Although the CDC states that currently there is no evidence to suggest that handling food or eating is associated with directly spreading COVID-19, it is possible that a person can get COVID-19 by touching a surface or object, including food, food packaging, or utensils that have the virus on it, and then touching their own mouth, nose, or possibly their eyes. We want to be mindful to continue practicing safe food handling practices while also creating spaces that limit the number of people crowding together. So if you're going to take up Dr. Mantello's suggestion of bringing cookies to a neighbor during the holidays, just be mindful of how you're packaging those cookies. If you decide to volunteer and give out food to your neighbors, be mindful of safety practices during that time. Being safe during the holiday season. If you're going to attend a gathering, make your celebration as safe as possible. In addition to following the steps that have already been discussed, everyone can take to make that their Thanksgiving safer. We want to also recommend bringing your own food or drink, maybe creating a space where you can all meet distantly while having your own meal that you prepared yourself. Wear a mask and safely store your mask while eating and drinking, and being mindful of your distance from another person while you're eating and drinking. Avoid going in and out of areas where food is being prepared or handled, such as the kitchen. And think about using a single-use option like salad dressing or condiment that may come in packets, disposable items like food containers, plates, and utensils for the purposes of this gathering. If you're going to host a Thanksgiving gathering, if you want to have guests to your home, be sure to follow steps that everyone can take to make it a safer Thanksgiving. A small outdoor meal with family and friends who live in your community. If you have a backyard or a nearby park that can be facilitated at, if the weather is on your side. Limiting the number of guests, again, recommendations are to keep gatherings small. Have a conversation with your guest ahead of time to set the expectations of what celebrating together looks like. Make sure you're all in agreement on the distancing you will have and that you've consented to the same practices, right? Sometimes we don't make those things clear and people will start coming up to us and trying to hug us or do other things that we're not comfortable with. So let's have those conversations beforehand to avoid those situations. Clean and disinfect areas that are touched. So even if you're going to be outside, if you're bringing chairs or tables, make sure those are disinfected before you pack them back up. You may want to even bring gloves for that practice. Limit the number of people in food preparation areas. Make agreements on who's going to prepare what food and how you're going to share it, and think about that practice. And again, if possible, have guests bring their own food or provide guests with disposable containers that they can grab for themselves, and that's their container of food for the day. If you're sharing food, have one person serve the food and use single options, plastic utensils, disposable materials. If you're in a case where you may have to travel, obviously we want to acknowledge that travel can increase your chances of spreading and getting COVID-19. Staying home is your best option for protecting yourself and those around you. If travel is the only option you have, check the travel restrictions of where you're going to go before you go and what the return policies will be. As Dr. Mantello informed us, there have been some changes to the quarantine practices that are recommended for travel. So keep up to date with those because they do change. Get your flu shot before you travel. And again, we will be sending out the information. We have already put it in the chat, but we'll send it out in an email where to get your flu shot. Always wear a mask in public settings and on public transportation. This would include on the airplane itself. Stay at least 6 feet apart from anyone who is not in your household. Wash your hands often, keep hand sanitizer with you. Avoid touching your mask, your eyes, your nose, and your mouth. And then again, bring extra supplies, have extra masks and extra hand sanitizer because you don't know what your access will be once you've gotten to someplace else. If you do decide to host people, again, be sure to clean and disinfect. I know I've said that once. We really want to emphasize it. It's very easy to, after the holidays, think, well, that was a great meal, and now I get to go to bed till the next day, but we want to do the emphasis on disinfecting our home and anything that we share with individuals. It's really important this year in particular. If you decide that having a Thanksgiving gathering is just going to be too stressful, here are some activities you can consider. Hosting a virtual Thanksgiving meal with friends. You could do a recipe swap virtually and see what each other made. Schedule time to share a meal together. Have people share recipes, show their turkey and other dishes they prepared, and maybe talk about the different ways you've prepared them. It could be a fun way to exchange recipes and see the process. Watch television and play games with people in your household. It's a great time to dust off board games or get into a Netflix binge. It's less likely to be bothered than on other days. Shop online. There'll be fantastic sales. More and more companies are making great sales available to people because of the holiday and the inability to have Black Friday in the traditional sense. So it would be a good time to utilize those sales. Look into contactless services for purchasing items like curbside pickup, including for your meals. Shop in an open air market if you decide to go out during this time of year. There's a lot of farmers markets and things of that nature, and be mindful of the 6 feet you want to keep from others while you're at those. Prepare your dishes however you may normally, but deliver them to family and neighbors in disposable contacts and leave them on porches so you're not having direct contact. Participate in a gratitude activity, writing down things you're grateful for and sharing them with family and friends. This would be a great time to really think actively about those kinds of things and share them in a safe way. So with that in mind, I want to thank everyone for joining us. I'm grateful that you were all able to be here. It's a nice segue. For further information on anything that was discussed today, please just visit our website, the Pride Center Staten Island, pridecentersi.org rather. And we will be sending out information on everything that was discussed. All the visuals and handouts will be in your inbox that you registered for the event with. And I look to my colleague, Asia, if there's anything else you want to share.
Thank you, Arthur. No, I just wanted to say thank you again to our guest speakers and giving their talent, their information, and their time. It was wonderful to hear. I'm hopeful that everyone that was able to attend this evening felt fulfilled and was able to have some of their anxieties, some of their stresses, or some of their question marks slightly brought down a bit as we enter in this holiday season. And thank you, Arthur, for moderating for us this evening.
My absolute pleasure. I wish everyone a very safe version of the holidays as they come up. I hope everyone's able to adapt and make the most of this joyous time of year. And if there's any way that we can help at the center, we are here for you. Please do not hesitate to reach out through our social media, our Instagram, our Facebook, our Twitter. We absolutely want to be here to support. And again, I want to thank my colleague, Tommy Castino, and Dr. Ginny Mantello for joining us this evening, and everyone who was able to make time this evening to have this conversation. We're really grateful for you all.